So thank you everyone for joining us today for the Ask About the Vax Q&A session with Dr. K. She is a board certified and fellowship trained infectious disease specialist. We'll start with covering the topic of why you should get a vaccine, even if you've had a COVID-19 infection, and then we'll move into answering your questions. So let's go ahead and get started. And Dr. K, I'll let you introduce yourself.
Leslie, thank you so much. So my name is Katugaha. I go by Dr. K. I joined as the Assistant Medical Director for Infectious Diseases here in June. So I haven't met all of you yet, but I'm very much looking forward to meeting all of you. It's an honor for me to be here. As Leslie said, I am an infectious disease physician and have been since 2009, but I do want you all to know that I consider myself a member of the Jacksonville community and that I'm also a mother of two. And so, I come to you with those voices also. So I am going to talk to you at the start and then open up to questions. And what I'm here to talk to you about is, should you get the COVID vaccine if you've had COVID already? So this is a very hard topic, and the pandemic has been challenging in so many ways. And one of the ways that the pandemic has been challenging is that there's so much information out there that becomes frustrating, confusing, which source do I trust? And actually that's a huge part of my whole job, is to analyze all this data and see what sources they're coming from. So right now, the sources that we trust most, the NIH, the CDC, the Infectious Disease Society of America, that's what I'm going to present to you today. So according to the CDC guidelines, you do need a vaccine even if you've had COVID before. And this is based in science, this is based in the history of vaccines, and this is based in data. So just to touch on the science aspect of it, we don't know enough about the antibodies when you have had COVID before. So we don't know if you had mild disease, does that mean you have fewer antibodies? If you had severe disease, do you have more? We don't know what part of the virus your natural antibodies are targeting. We just don't know that much about natural immunities and the antibodies that you get. Versus if you get the vaccine, then we have lots of data on that. So there was a study done in Seattle at the Fred Hutchinson Cancer Research Institute that was funded by the NIH. And what it did is this is the very basic science, so bear with me, but it looked at the actual spike protein, and it looked at an area on the spike protein, which is the receptor binding domain. And so what the mRNA vaccines do is they teach your cells how to make this spike protein, which is a harmless protein that the virus carries. And then there's a specific part called this receptor binding domain. And they studied the blood of people who have had the vaccine and people who have had natural COVID. And what they saw is that the vaccine targets this area and targets more mutations of this area in a different way than if you've had it naturally. And it targets it in a way that's, it targets more variations of it if you've had the actual vaccine and not natural COVID. And there are many theories as to why that happens. Maybe the mRNA shows it in different forms. Maybe it goes in the muscle versus if you get natural COVID, you just breathe it. But in the muscle, the immune response is really strong. It really has a chance to work against what's developed and what it sees. But these are theories, but this is how it works. This is why the scientists believe that the vaccine works against all these new variants because of insights and scientific background like this. So that's the science aspect. Then the history aspect, the only infectious disease that we've ever gotten rid of is smallpox. And that is, we did it through vaccine, not natural immunity, not herd immunity, because it takes too long. And then the third thing is the data. So a lot of people ask, how long does natural immunity last? And there are studies out there showing that could last up to 8 months, which is a long time. But again, we don't know enough about it. And then data shows, so there was a study in Denmark that showed, they looked at the first wave and then they looked at reinfection. And then they looked at how protected you are. And so if you are young, you are 80% protected. If you were over 65, you are 47% protected. These are looking at numbers, these are looking at studies, but we have really good data from Pfizer and Moderna about these vaccines that within 6 months, you stay 90% protected. So Delta is rampant. Right now, we're at 98% capacity and have 550 patients with COVID across our systems. So looking at these numbers, looking at 80%, if you're in the best case scenario versus higher than 90%, it makes a huge difference. And that's not to say that the immunity only lasts 6 months with the vaccine. That's just to say these are the numbers that we have. So these are reasons that we should be getting the vaccine even if you've had COVID. And then as an additional bonus, many scientists are saying, and there are smaller studies showing that if you get the vaccine and you've had natural infection, that's actually called a hybrid response or hybrid immunity, that you are best off to protect yourself against COVID. You're actually even better off than someone who just had the vaccine and didn't have COVID before. So that's where I'll start, and I can open up to any questions.
Perfect. So a lot of you submitted questions before the event today, so I'll start with some of those. For people who have had COVID and they now need to get the vaccine, how long do they have to wait before they get the vaccine?
Great. So the recommendations have changed, and the CDC used to say, months ago, wait 3 months. That was also based on the availability of the vaccine. So the recommendations now are that if you've had COVID and you're symptom free, and then you've cleared the amount of isolation time required by CDC, which is 10 days if you have mild disease and 20 days if you've had severe disease, then you are good to get the vaccine. So it could be in as early as 3 weeks to 1 month after you've had COVID, you can go ahead and get the vaccine.
Perfect. Thank you. Another question that was submitted that you maybe have touched on a little bit, but if I get the vaccine, we're seeing some breakthrough cases. So you can still get COVID if you had the vaccine. Why should you still get the vaccine?
So it is true, there are breakthrough infections, but they are far fewer than infections if you don't have the vaccine. In fact, there was a study that came out of Imperial College London just today showing that if you've had the vaccine, you're 3 times less likely to get COVID. So the reason is because, if your chance of going outside and getting COVID were very low, then sure, you can, wait it out. But in the world that we live in, our chance of walking out and getting COVID is extremely high. So that would be why you're 3 times less likely than if you don't get the vaccine.
Awesome. Thank you. So I think some people are deciding which vaccine should they get. What are your thoughts on that?
Sure. So to my understanding, here at Baptist, we have Moderna. There is excellent data on the Pfizer and the Moderna, which we call the mRNA vaccines, that both of them should have showed that at 6 months you have 90% efficacy, which means you're 90% protected, say. So you should get whatever you can get in terms of Pfizer and Moderna, wherever you can get it. There's no big difference that would tell me to direct a person to get one over the other.
Awesome. Thank you. So can you talk a little bit about what is in the vaccine and if the ingredients are safe? We had this question beforehand, and we also have a question in the chat about how the vaccines are produced.
So they're both kind of the same. So the Moderna has a nucleoside modified mRNA that encodes the viral spike, as does the Pfizer. And then that's the active ingredient. And then if you go on the CDC website, you can see the other ingredients. So the other ingredients, they're 1-methyl-oxypolyethylene glycol, cholesterol, a phosphocholine. I know these are kind of just words to you, acetic acid, sodium acetate, sucrose. They're vaccine components. There's nothing kind of out of the norm about what's in them. And then there are very clear, if you go on the CDC, they'll list them and break them down in even more scientific terminology than I just said.
Awesome. Thank you. So we had a question in Kat, how does the vaccine impact pregnancy and breastfeeding? Is a baby exposed to the vaccine in either of these circumstances? And do we have data on complications? So before we hop into that question, I will say we did a session, an awesome session last week with two of our doctors all about fertility, pregnancy, the COVID-19 vaccine. And we're probably going to host another one of those again soon. But also, Dr. K, I'll let you speak a little bit about that today, because I think that's a big question that I've heard for sure.
And I can keep this one brief because it was a wonderful session that you had last week. But the vaccine is very safe in pregnancy, and all the OB societies have gone ahead and recommended it in pregnancy because the risk of not getting the vaccine is potentially getting COVID, which is so much more catastrophic in pregnancy. So it's very safe in pregnancy. And then actually it's supposed to be beneficial, not just safe, but beneficial in breastfeeding, because you can pass some antibody. There have been studies showing that you can pass some of that antibody onto your baby.
Perfect. Can you speak a bit to the severity of disease if you have a breakthrough after getting the vaccine?
Yes. So vaccines are very efficacious in preventing hospitalizations, severe disease, and death. So even if these cases of reinfection that we see are relatively mild, and I should have said that earlier, that's another reason to get the vaccine, because if you actually get the disease, you'll be less sick. You likely won't have to be hospitalized, and likely won't end up on a ventilator or dead. So.
Perfect. Let's talk a little bit about vaccine side effects. So we've had a lot of questions submitted beforehand, and I'm seeing some in the chat. Are there long-term side effects from being injected with mRNA? What are the long-term side effects? How do we know it's safe?
Sure. So mRNA vaccines, first of all, even though we are first hearing about them in terms of COVID, they've been around for decades and they've been tested for decades. So we actually know more about mRNA vaccines than one would think. So we obviously, since we started giving this vaccine out in 2020, we don't have 5-year data or long-term data. So how can I tell you with confidence that you won't get a long-term side effect? So the reason that I can do it is because I'm looking at the history of vaccines. So when you look at the history of vaccines, there are vaccines like the oral polio, which has now been taken off, the swine flu, the influenza vaccine, and then there are ones that have caused side effects that have limited certain populations from getting them. So those are like yellow fever vaccine, and then there's the MMR. All of the side effects that we've ever seen from vaccines have happened within the first 8 weeks. So looking at the history of vaccines, there's not a vaccine where I can say, that came out in this year, and then 3 years later, this really bad side effect happened. The side effects that happen usually present themselves in 6 to 8 weeks, and that's based on our history of vaccines, and that's where we're at.
Awesome, thank you. So this is a little bit of more about COVID than just the vaccine, but are there any vitamins or supplements recommended to help boost the immune system to protect against COVID?
There aren't vitamins and supplements directly to help against COVID that we have to recommend to individuals. What I would say is in other ways, keep yourself healthy. When doctors' offices, right now we may have limited visits because we're in the surge, but keep yourself healthy in other ways. Make sure that you're going to the doctor, seeing the doctor, up to date with all the other health maintenance issues that you need to take care of. That's what I would say, to stay healthy in other ways. In terms of supplements that can help with COVID, it's just maintaining a healthy immune system and lifestyle.
Perfect. So if someone received the Johnson & Johnson vaccine in April or one of the other vaccines, should they get another vaccine later?
So right now, we are not, if you've been vaccinated once, then we're not necessarily recommending boosters around the country to anyone, even if the one you had was Johnson & Johnson. So this data is constantly changing and may change. But right now, if you've had one series, then that either of Moderna or Pfizer or Johnson & Johnson, then that should be enough at this time. There's lots of talk about a third booster. Right now, that's not being recommended by the CDC for healthy individuals who aren't transplant patients or aren't immunocompromised for any other reason.
Okay, awesome. And similar question. So if you got your first dose of Pfizer or Moderna and you missed your deadline to get yours, or you missed your regular time frame, your 21 days or your 28 days to get your second dose, should you still go get it?
So yes. So first off, we say the 21 and the 28 days, but really 42 days are good. Like that, we try to give ourselves a margin in science. So actually, you should still have the same protection theoretically if you make it within 42 days. But let's say you've missed that and it's been 3 months, you should still go get the second vaccine to say that you completed the series and to complete the series.
Perfect. Just reading some awesome questions in the chat. Thank you to everyone who is submitting them. A follow-up question on your first section about antibodies from the vaccine. Do we have any data on how long the antibodies from the vaccine protect us from COVID beyond those 6 months?
So there's data showing that it protects us for 1 year from the vaccine. And then we haven't had the opportunity to study it necessarily beyond that, but we do presume that the vaccine will give you immunity for a year. And in the future, I personally believe, so this is my personal belief, that we'll have to get, there will be annual vaccines. It'll be more like a flu shot. And so the thinking is that for 1 year, you are well protected.
Awesome. So this is a good question, especially with the vaccine requirement at Baptist Health and it being around the same time that we're required to get our flu vaccine. Are there any issues with getting other vaccines near or in between your COVID vaccine?
No. Co-administration, that's what we call it, is absolutely fine. So you can certainly get your flu and your COVID vaccine on the same day, and other vaccines as well.
Awesome, thank you. Okay, this is a great question. This next, and actually we're going to have a session with Dr. K on this topic, the history of vaccines, EUA, FDA approval, all that next week. So we'll be sending out that invitation probably tomorrow, but let's go ahead and jump into it today as a little preview. Why hasn't the vaccine been FDA approved? Doesn't it take years to get FDA approval after intense research?
So actually, I don't think, or not in my lifetime, has kind of the process of a vaccine getting approved been so in the news and in the media as now. So what an EUA is that usually it's only in times of emergency use authorization, and the FDA looks at a shorter time period of data. So they can look at 2 months of safety data after people have gotten 2 vaccines. And that's what they did. And so they approved Moderna and Pfizer in December. So now they're looking at full approval, and usually the FDA likes to get 6 months of safety data. So people have gotten 2 vaccines, and they've had 6 months of safety data. Then the vaccine companies submit something called a biologic licensing application, which is a hundreds of page document compiling all the data they have of everything that happened on all these individuals that they've been testing. Right. And so usually it's this process, and then the FDA goes back and forth. They read it, they review it, they scrutinize it, then they go back to the company with questions. So it's generally a long process, and it generally takes 6 months of data. So we have to gather the 6 months. So just think, Pfizer only applied in May, and then Moderna in June, and we're in August. So it's like we've only had 2-3 months of their FDA's time scrutinizing the data. So the FDA says they're putting additional resources into making this process happen faster, but it's not that the vaccine's not safe. That's not the reason that it's not been fully approved yet. It's just that this is a process, and usually it takes time to make this process happen. And the FDA doesn't want to, while they realize many experts are pushing the FDA to kind of make it come out faster so people feel more confident, but the FDA also wants to follow the semblance of the process that it typically follows. So it has more to do with the process than the safety of the vaccine. Millions of people in this country have had the vaccine in a safe and effective manner.
Awesome, thank you. So I've had a couple people join late and ask some questions in the chat, which is totally fine. We know that you all are busy. This session will be recorded, and I'll send out a link to everyone who is on today who registered through Eventbrite, and we'll send out a link in the weekly WhatsApp as well. And then again, about fertility, we had an entire session on that. We're going to be hosting some Facebook Lives coming up soon, and probably another session like this. So we'll definitely get to all your questions on fertility and pregnancy. Next question. If you've had a reaction to the flu shot, how likely would you be to have a reaction to the COVID?
Okay, that's an excellent question. So they've actually, the FDA has categorized this. So they've written absolute contraindications, which means you can't get a COVID vaccine. And in that category is if you've had an anaphylactic or a severe, I can't breathe type reaction when you got the first COVID vaccine, then you can't get another. If you've had a reaction to any other vaccine, like the flu vaccine, that's what we call a precaution, but you can still get the COVID vaccine. You have to speak to your physician, and many times your physician will have an allergist see you as well, refer you to an allergist, and you have to wait 30 minutes after, once you get the COVID vaccine, you have to be monitored for 30 minutes. So that falls in a category called precaution. So yes, you can still get it. You will have a little more to do in terms of seeing your physician, getting clearance, and waiting for the additional 30 minutes.
Perfect, thank you. So if you've had COVID, do you still need to get both doses of the vaccine, or is one dose sufficient?
If you've had COVID, you still need both doses of the vaccine. So I know that there may be data out there that says one is protective. And so it's all protective. So if you have natural immunity, it's a little bit protective. If you get one vaccine, it's a little more protective. But the best thing you can do for yourself is to complete the series. So the CDC and the FDA now is saying get both the vaccines. And one thing I didn't touch upon earlier is that idea of maybe getting one vaccine was when the Alpha variant was the predominant variant. But now we have the meaner Delta variant, which is above 90% in this country, right? So they were thinking, one vaccine may be enough if it were Alpha, and Alpha we're fighting. But now in the setting of Delta, it's very important to protect yourself as much as you can, which means both of the mRNA vaccines. Both doses.
Perfect. Okay, so we've had this question a couple times. Some team members have expressed religious concerns that the vaccines have been derived and or tested using embryo cells. Could you comment on this?
Yes. So I actually don't know where that came about. That's a rumor, and that's absolutely untrue. So the Pfizer and all of the vaccines, but I'm just talking Pfizer and Moderna, so first you have an idea, and then there are animal studies. Then you do a phase 1 study, which is in a small number of people to see, if it's able to put out there. Then you do a phase 2 study, and that is when you actually test the dosing. And then after you do phase 2, you do phase 3, and then you roll out the study to hundreds of thousands of people if you can, to see if it's safe and efficacious. So Pfizer and Moderna, they actually did their trials in adults and healthy adults. They didn't even use children. That's why it's not approved for children under 12. There are studies now on children under 12, but it was adults. And now actually, when they apply for their license and even for the EUA, they have to show that, okay, we used women, we used minorities, and they have to give a breakdown of the people that they used. So if you go actually on the CDC website, you can actually see exactly the breakdowns of the ages of people who were used, and then you can see the ethnicities, you can see the gender, so you can see the countries. All of this is available data, but it was done in adults, not children, and then certainly not embryos. And I don't even know how that rumor came about, but please, it's not true. And most, like if you read on any medical type website, it'll debunk that theory. And you can even read on Pfizer and Moderna's websites the breakdown of individuals who are used.
Perfect. Thank you. If you have an autoimmune disorder, is it still safe for you to get the COVID vaccine?
Yes, absolutely. So in fact, people ask this all the time. If they have autoimmune disorders, if they have cancer, if they have transplant, if they're immunocompromised, should they get the COVID vaccine? And the answer is yes. And so the FDA and CDC, they've done risk-benefit analyses, and the benefits of getting the vaccine are greater than the risks in these populations, especially because these populations are more likely to get sick if they get COVID.
Should we check for COVID antibodies prior to getting the vaccine if we recently tested positive for COVID? Does the antibody level make a difference?
So that's the thing. It really does. Let's say you get tested and you find out that you have antibody. We as scientists don't know enough about what that antibody means from the natural immunity. Like we don't know what part of the spike protein it targets. We don't know we don't know enough about antibodies that are derived from natural immunity to say it'll protect you. So even if we get like a number, we don't know what number keeps you safe in terms of like the antibody quantity. So even if you test yes for the antibody, the truth is you still need the vaccine. So there's no point in getting an antibody test.
So this is from someone in the chat. I had COVID and my heart rate increased during the sickness and took months afterwards to return to normal. Will the vaccine cause my heart rate to increase?
Okay, so this is a tough one. So people who have had COVID, sometimes they have a reaction more so to the first vaccine than the second. If you haven't had COVID, then you have more of a reaction, usually the second, the booster shot. But in terms of the significant side effects, like I had shortness of breath for months, I had fast heart rate for months, those won't happen after the vaccine. What'll happen after the vaccine, or what will likely happen, is that you'll have fevers, you'll have chills, you'll have body aches, you'll have, you may have headache, fatigue, you'll have to slow down, usually. But those symptoms usually resolve within 48 hours. And sometimes it can be longer, sometimes it can be 72 hours, sometimes it can be 4 to 5 days, but it won't last for months. These are, short term. What's happening is the vaccine is that your body is seeing something that they think is COVID again. It's not COVID, but they're thinking they're seeing it and they're ramping up. But certainly the same, we call it sequela that you get from COVID, which is fast heart rate, fatigue that lasts for months, oxygen requirements that last for months. Those don't happen with the vaccine. That's why actually providers are, coming on here and pleading with people to get the vaccine, because those are the side effects of COVID. And those are disastrous and long term, but certainly not the ones of the vaccine.
Perfect. Thank you. So this has been rapid fire. Dr. K, you have been amazing. I've gotten a lot of questions in the chat. I do want to open it up for people on the phone for our last 2 minutes who may just be on the phone and not able to type a question in the chat. So whoever wants to unmute, I know there are a lot of people on, so just go for it.
I'm a pediatrician. I had the disease Christmas morning, and the duration was about a week. In March, I had the J&J. I've heard some discussion about possible vaccine stacking with mRNA on top of the viral vector vaccine. And I just wanted to get your thoughts on that, as well as I don't necessarily have a lot of data on any induction of any type of GBS type of reaction with too many vaccines, but I'm interested in vaccine stacking.
So right now, if the CDC says that if you've had Johnson & Johnson, that you don't need to get another series here in the United States. You don't need to get the mRNA vaccine. That being said, the ones that are really showing efficacy in terms of the protection against variants are the mRNA vaccines. So I feel like that can change anytime. And there are many infectious disease experts coming out and saying that you should, if you've had Johnson & Johnson, that it's still a good idea to get Moderna or Pfizer. Right now, that hasn't come out as, within the science, and CDC hasn't changed its recommendation. I personally, so now I'm taking myself out of the recommendations. I personally think that we might see that coming, that Johnson & Johnson may not be sufficient because it doesn't have enough against variants, and that in the future, the recommendation may be to get an mRNA if you've had a viral vector vaccine.
And does a 6-month lag time between the J&J and an mRNA seem reasonable?
Absolutely. I think if you, yes. In fact, we have this data from people from foreign countries who are coming to the United States and, you know, they first got a viral vector, they got AstraZeneca, or they got Johnson & Johnson, and usually 3 months is sufficient for them to start another series.
Okay, thank you.
Sure.
Good afternoon. I'm going to piggyback off of that as well. I did receive a J&J back in April, and I honestly feel like I don't have enough coverage because the least little person that sneezes around me, I feel like I'm coming down with something, and it's not in my head. Because the CDC has not recommended you actually stacking, is it your personal choice that you can go ahead and get a Pfizer or Moderna, or you still would just basically have to wait until the CDC actually states that they're being recommended?
It is a little bit of a tricky one. Usually we wait for the full CDC recommendation, but I don't think it's that far away. And I personally think that it would be a good idea for someone who's had, my personal belief, that someone who's had a J&J to get an mRNA series.
Good enough. Okay. Because I really feel like I have no coverage. Even though I take my vitamins, I keep my mask on, but I just feel as if, and I did not get sick, but my daughter got sick. My mom, her foot swelled up afterwards, and she started having foot cramps, but I had no symptoms, no tiredness, nothing.
Yes.
So I feel like I don't know. I'm not going crazy, but I just feel like I just don't have enough coverage.
You're not going crazy. In fact, it must be very scary because everything we're seeing is in our scientific data and in the news is that the mRNAs protect us against Delta and the variants. So it's a very real concern. And I validate it, and I think pretty soon that the recommendations may change.
Okay.
mRNAs are kind of our future, like in terms of COVID response right now.
Okay.
Awesome. Thank you, everyone. So we're at 12:32. I know this time always passes really quickly. So thank you so much for joining us today. Thank you, Dr. K, again. You are just fabulous and full of knowledge, and I just love learning from you every time that we get to talk. So again, this session will be recorded. It'll be on YouTube. If you want to share with your family and friends, we'll also share with all Baptist Health team members and physicians. So be on the lookout for that in our weekly What's Up newsletter. We're periodically sending out emails about vaccine opportunities here at Baptist Health on multiple of our hospital campuses, but you're also welcome to get a COVID-19 vaccine wherever it's most convenient for you. I love vaccines.gov. You can search your zip code and find something close to home or close to work. And then you will just submit your CDC, a photo of your CDC card to Employee Health. So again, thank you everyone so much for joining us today. A special thank you to Dr. K, and we'll have another session next Thursday for anyone who's interested in joining that as well. So, all right. Thank you, everyone.
Thank you.
Thank you so much.